Hi everybody, Dr. Daniel. Today I'm talking about what should you do for a severe migraine? Wow, I'd like to know the answer to that, wouldn't you? Well, migraines are really prevalent and they're present in 12% of the world population, and they are disabling. They can interfere in work, at school, and things like that. And they have severe symptoms. They're usually one-sided, behind an eye or in the temple. On a scale to 1 to 10, they are 5 to 10, or the International Classification of Headache Association says they are moderate to severe. They may be associated with sensitivity to light and smell and sound. And then probably the worst parts of, for some persons, the migraine thing is it turns on your stomach. It makes your stomach upset. Turns on the vagus nerve that goes to the stomach. So you get nauseated, the nausea center in the brain is turned on, and you can vomit with it. And that's really limiting. And also, one of the criteria for diagnosis of migraine is that persons do not want to be up with it. They lie down, so that climbing stairs, walking, and exercise would really aggravate migraine for people, make it worse for them. It's said that in cluster headache patients get up and walk around, and migraine patients lie down. Well, what is migraine? Well, it's really a chronic, genetic, episodic, long-term neurologic problem. Consider that. So what would we do for severe migraine? I have some tips that are helpful, some of which are just like ordinary things. Some of them involve medication. So the first thing you should do is to lie down with it. You should get in the dark. You should get in the quiet. You should hydrate with fluids. You should try to go to sleep if you can. That would be helpful. You should turn off your cell phone. If you have medication you can take, particularly a triptan, and to have that you would have to have seen a doctor. And the problem with that is that something like 50% of persons in America who have migraine have never had a medical diagnosis by a doctor. So half of them are not going to have a triptan. You want to take your medicine early, and then later after that, you would go see a physician to help you with the headaches. And consider that if you had 3 or 4 migraines a month, that may be the level the doctor recommends you get on a daily preventive drug. And we have great drugs for that now. And after the attack, also, you should do the migraine lifestyle. And I want you to see a series of doctors. This is a joke, but tolerate me here, please. I want you to see Dr. Rest. I want you to see Dr. Quiet, Dr. Eat Good, Dr. Sleep Right, Dr. Low Stress, Dr. Nature, which means get out and see the beautiful world we have, and then Dr. Exercise. Okay, now I'm going to discuss some of these ideas in more detail. So what's the deal about lying down? Well, migraine just makes you feel so bad when you're up, you need to be down. That's just as simple as that. You don't want to be up. And so if a migraine patient gets a headache, they would probably take their medicine and lie down in a dark room, the smart ones. And if they can, they take a break at work, or they go to a room so they can lie down, or things like that. But many people don't have a diagnosis of migraine. They don't have a plan how to treat migraine at all. And headache just wham, hits them. They wake up with it on a work morning, or they wake up with it on a Saturday headache or a Sunday morning headache, and they take over-the-counter medicines, which after a while can inflame your stomach. And over-the-counter medicines just work on a little bit of pain modulation. But if you take a triptan, they can really help because they get into the migraine process and block the inflammatory chemicals that come out during a migraine headache. So why is it better to get in the dark with the migraine? Well, the light of the migraine hitting your retinal fibers and the optic nerve or the trigeminal nerve, which carries pain, are connected somehow, and we don't really understand that, but there's a relationship there, and it hurts. And so persons with migraine want to be in a dark room. And many people who've had migraine for years are always the type that would always wear sunglasses, and they don't like to go to the beach on sunny days because it's just too dadgum bright. I have a web-page article on that, on photophobia affecting migraine. You might want to check that out. That's drmigraine.com. Well, how's the dehydration help migraine? Well, I don't really understand that, but it does. I did have a chance in 1970 when I was looking around for my internship to interview with a Central American medical school physician who had invented Gatorade, if you can imagine that. Wow, I bet he made a lot of money. And so now we have Gatorade or sports drink that we can drink while we're exercising. You can take it with a bad migraine. Dehydration makes the migraine pain worse and hurt more. Persons have told me if they can go to sleep in the middle of a migraine, it's a good deal. And some people can do that. They just, simple migraine patients will take 2 Tylenol, they'll close the blinds, lie down in a quiet room, and go sleep. And the headache is better when they wake up, or many times it's so they're able to get back into their lives at any rate. Another idea is to use ice for migraine. Now, Robert Frost in his famous poem said, "Ice is nice and will suffice." And in this situation, I'm saying it's just a cheap, easy thing you can use on your head. In my home, we have a thing called a Boo Boo Bunny, and it's in the refrigerator right now, although my kids are grown up, but I have grandchildren. And if they get a little owie or bump on their head or leg or something, we would get this little blue bunny, which has made out of cloth, and in the center of it is a place for an ice cube, and we put that on their little owie. So cold helps pain. That's the idea here. So consider using that. I also advise persons to turn off their cell phone and go down. Why do I do that? Well, I don't want them reading. I advise people not to read during a bad migraine when they're trying to recover, not to watch television, not to read books or paper, and don't read on your cell phone cell phone. Also, I'd like them in the quiet. It's hard to get people to go in the quiet nowadays because everybody's up moving around and doing all kind of stuff. If you have a triptan, you should take your triptan medication at the onset of the headache. Or some people just can take simple things. Actually, I've had mild migraine all my life, and if I got it in the office when I'm working, when I get it when I'm working, I take my contacts out. I take 2 aspirin. I drink a Dr. Pepper, which has caffeine in it. Wear my glasses, and I do fine with that. But I have mild migraine, and not everybody has that. Some people have to take more drugs than that. All right, if you don't want to take medication for a headache, there have, since 2020, we have 3 new drugs that have come out, but they're really not better than the triptans. So there are 7 triptans, and the triptans are generic and pretty cheap, but you have to see a physician to get one of those pills. And you should treat early with one of those pills if you do it, because that stops the migraine process and blocks these chemicals from coming out. And over-the-counter drugs can't do that at all. They just provide a little pain. There are medical devices some people can consider, which is one of them is called Cephaly, which is a trigeminal nerve stimulator. You put on the forehead, and it kind of knocks down pain. They also have a vagal nerve stimulator you can put on your neck, and that'll help for headache as well. So I hope these ideas are helpful to you. There's some of them just really simple, common sense ideas to treating migraine. God bless all you folks who have migraine. I do have articles written on treating migraine. I have podcasts on that. I have YouTube videos on that, and also I have articles in my blog at drmigraine.com. So please click like down there to help me along to get this word out about migraine. I'll see you again on the next talk.